This video is about osteoarthritis. That's a very common and serious problem that affects a large number of people. Pain and stiffness and difficulty with movement can make life really miserable. But the question is, what can you do about it? What are the basic steps? What else is available other than painkiller medications that a doctor will prescribe for you that may cause other damaging problems in addition to your arthritis? So what can you do about the pain and stiffness of arthritis apart from taking non-steroidal anti-inflammatory drugs like ibuprofen or having your joints injected? Well, obviously the basics are you've got to consider weight and exercise. If you're carrying a big belly, you're going to put increased pressure on your hip and your knee and increase the severity of any OA that you have. If you lose weight, probably something around the order of a stone, and keep exercising, then you'll have a dramatic improvement in your symptoms. You must keep exercising because this stimulates cartilage repair and regeneration and joint lubrication. And as much as you can do as often as you can without being in significant pain is worth achieving. The known options in terms of supplements, I'm going to discuss 5 supplements that have evidence for them. That's boswellia, green tea extract, magnesium, curcumin and S-adenosyl-methionine. I'm going to talk briefly about HRT for women and about boron and resveratrol. And then the important thing you need to know is that fish oils, chondroitin and glucosamine are a waste of money. So I'm going to show you a little bit of scientific analysis. This is called a meta-analysis, and this involves several studies shown on the left of the slide here, combined together statistically to produce a meaningful conclusion. And you can see at the bottom here, the conclusion is this black diamond, which shows that there's a significant benefit of boswellia against controlled drugs. So that's the first piece of evidence. The second is a more recent randomized controlled trial on knee OA, comparing boswellia against a standardized form of boswellia against a placebo. And the pain scores are shown on the slide here with a bar, the placebo in the gold and the boswellia in the blue bars. And this is taking the drugs over a period of time until we get to day 120, sort of 3 months in, basically 4 months in. And at that time, there's a significant difference in the pain score in the treatment group. And you can see, if you look at the blue bars, you can see that they go down steadily. So it takes a bit of time to get the benefit, but by the time you've been taking it for a while, there is about a 30% reduction in pain with this treatment. So that's certainly something that's worth having because there are no downsides or side effects with boswellia. It has to be a standard form of boswellia, and in order to get the right concentration of the AKBA, which is the active ingredient, the standardization with this 5-loxin process achieves that. But you've got to pick the boswellia extract. And there are several other products on the market, even from this company, that aren't the extract. And so it's this product which has the significant amount of active drug. And 2 of these capsules a day would be the dose that you need. The SAMe, which is the methionine product, here's another study on knees comparing pain scores over a period of 4 months in 2 groups. And the first group, which is the dotted line, started on celecoxib, that's the non-steroidal drug, and then changed over to the SAMe, and the solid line started on the SAMe and then changed over to the celecoxib. And what you can see here is that the dotted line seems to give you a better approach in the first couple of months. But by the time you get to the end of the study, 4 months in, the scores are equal. So the methionine is a bit slow to get going, but at the end of 4 months, you've got the same benefit as you get with the non-steroidal drug, but with none of the side effects or problems or risks associated with that. So this is, again, a very interesting drug that is getting, in this case, you can see about a 50% reduction in pain score. So the dose used in that study was 1,200 milligrams. Some people have used as much as 1,600 milligrams, and a quality product is the one made by Swanson here, high potency, and to get the dose needed to match what was in the study, you'd need to take 3 of the capsules, but you could increase to 4 and see if that's necessary, because there won't be any adverse effects with it. It's important that this product is properly protected in foil, because it can easily deteriorate if exposed to light or any moisture or anything, and lots of the products that are on the market aren't produced to this quality. Curcumin, no point in taking turmeric tea or having more curries. That's not going to make any difference at all. You have to have a product which is designed to get something that's very non-absorbable, basically, into your system. And so it has to be modified in some way, and there are various techniques using nanomolecules, using phytosomes, using micronization, and so on. And the curcumin product produced in America by OmniActive is one of the technologies that improves drug absorption. And this is a study, again, showing pain score decrease over 84 days, and the lower dose of curcumin is the is the yellow bar, the double dose is the orange bar, and the placebo is the grey bar, and you can see a significant fall off in the pain score with curcumin, and that's a pretty impressive reduction with the bigger dose. In the UK, OmniActive's drug is sold by Lambert's with this brand name and formulation. Magnesium is important because this meta-analysis, the results at the bottom here, shows you that if you've got a high magnesium intake, a normal magnesium level, then you have a lower risk of OA. So the reverse of this is if you have a low magnesium intake, and about 30% of people over 55 are magnesium deficient, then you're going to increase your risk. So I recommend that you take, measuring magnesium is very difficult, so I suggest you take a magnesium supplement at night, and it needs to be an organic product, not an inorganic one. The Tom Oliver magnesium taurate has got established pharmacokinetics, and you need one of these capsules at night. The green tea extract, it's an interesting product. It's got lots of evidence of anti-inflammatory benefit in a number of different conditions, but there's not been much study of it in OA. So theoretically it should help, but there's not a lot of data. If you want to move on to this and try this, then a phytosomal product like the one made by Thorne, and you take 3 of these capsules a day. The boron is a trace element like magnesium. Some people swear by. There's a sort of theoretical basis that some people who are boron deficient can have increased arthritis, but not a lot of data to convince me. So I'm not necessarily suggesting you recommend this, but if you were determined to tick all the boxes, this is the product you'd use, a triple boron complex, and you take 2 of these 3 milligram capsules daily. Resveratrol, again, the same sort of concept as the green tea extract. If you were going to use this, then the micronization is the technology that's important. And the best product I can identify in the UK is by Ascent. And it's a powder that you can mix into a drink or put on your food. 2 of the little salt spoons in the jar a day, morning and evening, would be beneficial. With all of these drugs, where absorption is not brilliant compared with a lot of pharmaceutical drugs, but the products I recommended all have some evidence that they are absorbent and they do what they're supposed to. It may be beneficial to take some in the morning and some in the evening if you can be prepared to go to that degree of trouble in order to maintain blood levels. So don't waste money on fish oil or chondroitin or glucosamine, and consider as first option boswellia, methionine or curcumin, and the others as possibilities if you want to add them on. If you're a woman, you should be talking to a menopause expert about using HRT.